Welcome to the GFY Podcast, a podcast by healthcare professionals for healthcare professionals, providing insight on how to navigate your career so that you can go fix yourself. The GFY Podcast is hosted by Mike Bruno, a chiropractor and athletic trainer, and me, Michael Stant, an athletic trainer and certified strength conditioning specialist. Although we are healthcare providers, we are not your healthcare provider. We will discuss general health interventions in this podcast, but you should not take that as health advice that works in every situation. Before doing anything on your own or making any lifestyle changes, please consult with your own physician. This podcast and views from this podcast are separate from our full-time jobs and our own opinions. If you're enjoying the GFY podcast, please leave us a review on your listening platform and or subscribe to our podcast at YouTube. Links to our show can be found in the show notes on any platform that you're listening to. Today we have Abu, insert last name.
I thought you were gonna go for it.
No, I'm not going to embarrass myself right now. So, Abu, if you can just give us quick background, kind of how you came to be, where you're at now, and all the good stuff.
And your last name, maybe.
Got it.
I'm Abu Gergis. I'm a chiropractor and a coach. I'm located at Evo Health and Performance in Freehold, New Jersey. And my entire career has kind of been pretty convoluted, but it's ultimately boiled down to I've been an athlete my entire life. I've had family burned by the medical system. I've been personally burned by the medical system. And it's one of those, if you want something done right, do yourself. And it's kind of been a natural calling to go into service and healthcare for people. And I've been obsessed with it ever since.
Nice. Gorgies, Mike.
Gergis. Yeah, you're close. So the funny thing is, when you said Georges, my last name is Arabic for George. That's the direct translation. So you're that close.
Yes, I knew that. Yeah.
How do you pronounce your full name?
Avenue, but everybody calls me Abu. So
Avenue. Okay, good to know. All right. So Abu, the thing that I guess started our relationship was probably, where'd you go to chiropractic school again?
NYCC.
NYCC.
Yeah.
So did I meet you in the business group? Was that the first place I met you?
I think it was we were Instagram internet friends, and then we met formally in person at the business group.
Okay, cool.
Yeah.
So I know you were working as a private coach in Hoboken, right? Before you ended up in Freehold. So tell us about how that experience has shaped where you've ended up today, and what your treatment style and model is like.
Yeah, I mean, I've been a coach since I was 19. My first job was just group fitness classes and personal training out of a boxing gym. And that was my entry point into health coaching, yada, 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 yada. And I've just been running with that ever since. So I've always been a coach first, as well as an athlete. And it's always been at the forefront of my mind of, I enjoy working with athletic populations, healthy populations, or exercise focused populations, I should say. And having that at the forefront of my mind of how can I get this person to exercise as soon as possible in whatever limited fashion, giving their chief complaint or limitations or injury, because everybody on this call knows the severe health consequences if somebody is not exercising regularly. Mm-hmm. And that's kind of always at the forefront of my mind, obviously bearing any necessary red flags, yada, 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 yada. Two, of being in the personal training space and coaching space and working with multiple populations, I got to learn really early how important customer service and communication is. And I think that set me apart really quickly from a lot of new grads, a lot of my classmates coming out of school. And that's something I'm extremely grateful for.
Tell us more about that. What do you mean?
Yeah, I mean, we work with people. So if you can't get your point across, and we have conversations about this all the time, and it's one of my favorite topics of, we work with people. And at the end of the day, you can be the smartest person in any room, but if you can't effectively get your point across, you're nothing more than a walking anatomy textbook, which is effectively useless.
Yep.
That is the most important thing. Can you digest your knowledge, translate it to the person in front of you, and agree upon a action plan that both of you believe in? If those steps aren't getting checked off, something along the rehab process is going to go terribly wrong.
Mm.
So it's important that they understand what's going on. So you're not gonna go off and be like, "Hey, your posterior fascial line is kind of what you're like," right? You're not gonna start dropping terms that like they may or may not understand as well.
Y- Yeah, 100%. And if I do, I'm making sure I spend a little bit of time educating so the person has an understanding, because the patient in front of me, or client, if you're in the coaching space, doesn't matter, is the most important thing. Of us as clinicians, we are the least important character in this patient's health journey, rehab journey, whatever you want to call it. If they don't understand what's going on, what's the point? What are we doing?
100%.
So it's like, I see it as absolutely crucial for the patient to understand what's going on at whatever level their knowledge base is. It doesn't matter.
Yeah, communication is really the common thread among all of it. And I actually had a client the other day. I was like, in order, like, we have to get you clear answers to like know what's going on for us to even like know if it's a right fit to work together. So like, what would be the most beneficial way for me to communicate that to you? And she literally like sat back in her chair and was like, I've never been asked that before. I've either been like talked at like I'm an idiot, or like they talk to me like it's way over my head. So like, can you communicate it in as like simple terms as possible? So I was like, okay. So like the more analogies, the better. She's like, absolutely, let's do that. And she walked out of there. She texted me like later on that evening and was like, thank you so much for everything. Like I finally at least understand what's going on, which was a huge first step. Because if you don't know what's going on, the perfect plan is going to be far less effective because you're probably not going to do it as much. You're not going to buy into the process. And we know it's a long-term game. We've seen the whole journey up the mountain, but some people might get discouraged along the way because, it's a bumpy road. It's not a straight shot to the top.
Yeah, dude, that just fired me up. You having that conversation of just asking her how she likes to be communicated to and what style probably changed her life.
Yeah. Yeah.
And like, it's exhilarating. All you have to do is ask a question
Mhm.
and then abide by her answer.
Exactly. And it makes my job so much easier
Yeah.
because I tend to be the person who like I'll start to like verbal diarrhea and I'll start running away with it. And I'll take a step back and be like, all right, wait a second. Did you like questions? And usually people like they don't want to sound dumb. So like, no, I don't have any questions. I'm like, all right, cool. So I call it the mom test. And like, if you had to go home and tell your mom one sentence about what you learned today and like why it's important to what's going on, like what would that be? And they're like, as soon as they stutter, I'm like, okay, here it is in like third grade terms. Like, this is what I want you to remember and take home. And when they're able to retain that, like you're set up for success big time.
Like, I'm stealing that, the mom test.
The mom test. But for you, Abu, like I know you're a big runner now. Have you always been, or is this like a new uh evolution of like your training?
Yeah, running has always been a part of my life. Although running for sport, this is probably like the highest it's ever been as like priority in my training, health, personal. Like, it's a big part of my identity. But I've been running ever since I was like 14 for various reasons, whether I just straight up enjoyed it, like running around my neighborhood, training for sports. I played lacrosse, wrestled, and boxed. All of those require a asinine amount of running. So always been a part of the game, but this is probably, I would say, the last 7-ish years where running is the game for me. I just want to run far, and I want to run fast. There we go.
Dude, on so many of these podcasts, I've stolen your term. Abu, I don't know if it's his term, but he introduced me to party pace. And I say that all the time.
Bruno's a big party pace guy. Like,
Where's he, baby? Oh man. But it's so cool talking about like having, your diversity of sport background. When I was like I train, not at a high level, not to compete or anything, but I do a lot of like Muay Thai, like pad work and stuff. And when I'm doing that consistently, if I don't run for let's say a month or something, and I go and I just go for my normal easy run, the amount like my heart, I like looking at my heart rate. And I know I want to ask you about that because I saw your thing, but my heart rate stays lower and I'm able to push it a lot further and faster, a lot easier because I have like general like that conditioning. I'm hitting those higher spikes a lot more frequently than I would if I was doing like easy paced running more consistently. I've heard, I want to fire both of you up because I don't know how true this is, but I heard a guy on Instagram, so you know it's true. He said he's like, if you work harder, like a higher intensity of running more often, like your body's natural default, your slow pace is going to be objectively faster than if you only trained slow pace and rarely trained at high intensity. Trying to say that like if you continue to like gas your engine out, like you're going to have your baseline is going to be objectively faster. I'm just going to mic drop that and see what both of you guys have to say about that. Because I'm sure there's shades of gray to it, but I'm curious of your opinion.
Yeah, I mean, yeah, like, yeah, I'll go first. I'll go. I mean, yeah, I mean, you still need all of it. Like, you still need to do the high intensity work, your threshold runs, tempo runs, whatever it is, to be able to improve it. Like, yeah, that will ultimately improve your zone 2. Yeah, if you only did zone 2, I don't know where it came back. I think it's just because people go, oh, zone 2, that's how you fat burn or whatever. And I think that's probably what it's going after. It's like, hey, you can't just do zone 2 only. You will kind of plateau in a sense in your actual speed for a race. Now, you can, yeah, you could. So like when it comes to like figuring out what VO2 max is, if you really want to get into it, like there's two different calculations. It could just be straight up how long you're running for, but really it's just how much oxygen you take in. So there's two different calculations based on. So this really want to get into it. Apple Watch VO2 max is based on like how long you're running. Garmin is actually based on like your lactate threshold and how fast you're running. That is probably the more recommended standard of doing it from a performance standpoint. But yeah, I'm assuming that was that because I think, did you send it to me? I feel like I saw it for some reason. And I think that was basically just going on the, hey, you can't just do zone 2 training only if you're trying to be a performance athlete.
Yeah, I like party pace though. But to my point, like even though it's not actually running, like I wasn't doing more sprints, the Muay Thai stuff was way more intense and like I was like really pushing it. And the way that I saw that translate is when I would go to do my party pace was faster and it felt easier. That's where I was going with that. That makes sense.
It makes 100% sense. That's the big thing is you need the whole spectrum of zone 2 has gotten like a huge uptick of like running and endurance sports has been on a trend since COVID. The optimization of it is now on like a huge uptick. And this is something I'm very big on of solve the problem that's in front of you. A lot of people don't need more optimization. They don't need more specificity. They need more of the basics. And the pure basic is you have to hit the entire energy system or intensity spectrum, which is your easy zone 2 training, like Mike said, which is your tempo, which is your threshold, which is your high-end VO2. Like Bruno, that's why like when you do your Muay Thai and you do your party pace, you feel great because you're exploring the entire spectrum. You aren't just pigeonholing yourself into one little thing, even if it is quote unquote optimal. Right. And that's why I'm very big on if you are not training at high volumes, more times than not, you're better off just going out for a run and having a good time rather than trying to find out which specific energy system you're training. Yeah. Because the whole zone 2 craze came from the optimization of elite athletes. And these guys are running 100 plus miles a week consistently.
Yeah. And also trying to like the 80-20 stuff, like that's like when you're not actually training for something specifically, it like doesn't matter. Like it's also very impossible to do. Like if you're only running 10 miles a week and like you're gonna go, all right, so you'll do 8 miles very slow, and then I don't know, you'll have one workout of 4x800s, I guess could be the work. Like, you kind of just,
it makes no sense.
Yeah.
And it's like, all right, fine, if you're gonna do that, those 4 800s better be the hardest 800s of your life to have any like potent training effect. So volume is the biggest factor to that. Yes, a lot of zone 2 training matters, but the reason zone 2 is very special is it's not that fatiguing, so you can do a lot of it. That's why zone 2 is important, is you're able to do a lot. So if you're doing zone 2, you're doing a little, doesn't freaking matter.
Yeah.
Go out, have fun, train.
Yeah. Love that. Are you training for anything specifically right now?
Yeah. I got 100K in the spring and then 100 miler in the fall.
What's the so for us not used to the metric system, 100K
Yeah.
gets you to what?
62 miles, like 62-ish miles. I mean, ultra runners or ultra races, they always like to fudge the line. So might be 65, might be 7. Who the hell knows?
I get pissed off running a marathon. It's 26.5 on my watch. Like I'm like, yes, that's absolutely.
That is what happened to me. That was
Yeah.
issue, right? Yeah.
Yeah, that happened to me in Philly too. I was like, God damn it.
That's too funny. So Abu, I know the one of the Instagrams, by the way, great job on Instagram recently. I love the just like talking to camera, like calling people out. And it seems like very intentional. Like when you're like, I always had this problem. That's where a lot of my like talk to camera stuff came from, where it's like, hey, like I think I'm delayed in my argument. So it's like if I was talking to a person, I'm like, I didn't say exactly what I wanted to say. It's like you go on Instagram and you say it to the internet kind of thing. So it's like for me, it was like a super real world like application of it. So like when you were talking about like tracking your heart rate and stuff, can you just like fill everyone in on what you were talking about and then like go into a little more detail explaining it?
Yeah. One, thank you. Like the way I come up with my posts, somebody asked me the other day is we all are health professionals. We all work with real people. I just pick one of those people's like, all right, what cool thing did we talk about? Or did they ask a question that like hit a soft spot? I'm just going to talk about that.
Yeah.
And that day was somebody asked me about heart rate in zone 2. I was like, all right, let's talk about this and like clear the air. That post was about what I just said about the importance and utility of zone 2 and creating the quote unquote parameters for the people that it does matter for and the people that it doesn't matter for. And right now I see more people in the heart rate based training doesn't matter to them crowd, but they think it matters. And I was getting frustrated because they're leaving a lot of gains and progress on the table by trying to force themselves into this arbitrary box of, I need to stay in my heart rate zone. When in reality, that part of the game doesn't matter yet. They have a lot more prerequisites to check off, like consistency over a long period of time. And that's not a vague word. I'm talking months to years of consistency, not, I did 12 weeks training for my half marathon. No, I'm talking a near lifetime. You're training at higher volumes of, you're averaging 5 plus even 5 hours a week. We can debate on of endurance focused training. Those are the things that matter. And it's like, if you are this, great, this matters to you. If you are not, that is also okay, because you're going to make a lot of progress by focusing on other things and removing the cognitive load in training. I think that's something I'm very big on. And same thing as a clinician of, if we can make things simple, great, we're taking more action, making more progress. But if we're taking cognitive load and putting it somewhere, trying to be optimal, we are splitting our focus. And all of us knows what happens when you split focus.
100%.
Yeah.
So like I really like the concept you had of like going back to basics or only focusing on basics. Because a lot of times, especially in the rehab setting, the focus when someone's like, hey, I want, so PRI as an example, right? Like the super intricate, and as effective as that stuff can be, if someone's like, I'm never going to do this at home, that it's not going to be an effective strategy because it's way too complicated for them to do without you there. It's not an effective choice, right? So making sure you can do something. I always say, I want something that is impossible for you to screw up at home. So if you hate this or it's confusing or whatever, like you tell me, and there's always another way to do it. I've had people come back in and like take me up on that and be like, this made no sense at home, or like, I genuinely hated this, I'm not going to do it. I'm like, okay, cool. Thank you for the feedback, because like that's going to help us build a more effective strategy. So when you're talking about the simplicity of it, if you had to like talk to me about like, I've never ran in my life, like where would you recommend that I started?
I would start by keeping things as short and low pressure as possible. If you've never ran a day in your life, your biggest enemy is going to be gravity. of the thing that makes running hard and why people say, oh, running is bad for your knees, is it's not bad for your knees. It's just the earth is really freaking strong. And every time we leave it, yanks us right back down. And I don't know how much plyometric, I'm going to take it a little tangent.
Yeah.
I don't know how much like plyometric work you guys do with your patients, like towards the end, but that's the hardest part, is the force absorption, is eccentrically yielding and then reproducing that force. Because like, have you seen like a 40-year-old try and skip? It's like, okay, you haven't done that in a while. And it's like, I always say that when I introduce plyo, I was like, all right, when was the last time you skipped? I don't know. All right, let's skip. That's the hardest part, is learning how to cooperate with gravity. So keep it short, keep it fun, keep it low pressure, because when you keep it short, you're kind of eliminating the too much too soon factor of injury. When keeping it fun, you are eliminating the cognitive load, so you can stay present and just self-organize. And then week over week, if you feel good, add a little bit more. I would say just start with a 15-minute run, nice, chill, easy walk if you have to, it doesn't matter. Then next week, make it 20. Then the next, make it 30. Then add an extra day if you can. And congratulations, we just set your minimal viable volume. And we didn't get banged up. We didn't have to worry about heart rate. We didn't have to worry about whether or not their tendons are elastic, stiff.
Yeah.
I always, I don't know if you do this. So like, because with the whole heart rate thing, especially like if you're not trained for something, like you said, it go out the window / why even think about it. And even like when I was having Bruno do some of the marathon training this past summer, even then like your heart rate and the heat, it just like, it goes all over the place. It's not even like worth it to track it. And so typically I've always given like, hey, just be able to hold a conversation while running, and like even like encourage the go run with someone else that you can kind of just not think about it and just have a good time while doing it. Is that like similar to what you're doing? Because even the heart rate stuff doesn't correlate very well with a lot of people. That's why like a lot of people switch to RPE instead. Like, hey, go at an RPE pace instead.
Yeah, that's how I primarily run things, is purely RPE or some subjective term. I'm like, now I just talked about keeping things simple. Now let's start out.
Yeah.
All the evidence has shown RPE based prescriptions are almost just as accurate as heart rate, especially when it comes to getting specific energy systems. Of if you can speak in paragraphs, congratulations. The odds of you being in zone 2 are way higher than not.
Yeah.
And you don't have to freaking do this silly dab the whole entire run.
That was me, by the way. I was like, wait a second, I'm 155. I need to be 150.
Yeah, because like these watches too are also like they're delayed to the Apple Watch. Like if you have an Apple Watch, like if the Apple Watch felt super delayed on telling me anything, so
yeah. And it's like, not to bash on heart rate. I still look at it, but I use it as an interpretation of when I'm done with my runs. All right, I'll look at it. How accurate is our RPE? The second thing is, by intentionally not looking at your heart rate, you're honing in that skill of auto-regulation, which all of us know is very important, especially as an endurance athlete, because running is such a mental game. You have to learn how to feel. All right, it gets weird. After you get to a certain experience level, you can like kind of get within like plus or minus 3 BPMs of like, all right, where's my heart rate generally at?
Yeah.
That's a skill that needs practice. And every time you look at your watch, you remove the opportunity of honing in that skill, in my opinion. So getting good at auto regulation, which is just feeling things, will actually have more downstream effects had you been quote unquote specific by being really dialed in on your heart rate.
I like that. From a generalist approach, when we're talking about like intro, when we're talking like intro to running and things like that, or even let's take running out of it, even like rehabs, like intro to like skill acquisition, right? So the people who I see get into the most trouble and they get frustrated and usually give up the fastest is when they can't accept that they're at the basic level. Like they're thinking about this optimization and trying to overcomplicate shit. And it's like, dude, just go for a walk, please. You know, like you said, like, hey, I know you want to do all this, like go skiing with no knee pain, but let's see if you could skip first. Like there's so many check boxes that we need to hit. I literally write them on the board. I'm like, hey, so like usually my plans and programs break down into 3 phases of care. And in the first one, we're focused on getting rid of pain. And it's like, hey, that seems like we all know pain's complex. We know it's not coming from one thing. So like, these are the things that we essentially have to check off before we get there. Then we can look what's going on in the gym, and then we can look at what's going on performance-wise. But I'm not talking to you about your running mechanics until you can cover the basis of being able to, like, do this stuff. And when you lay it out there, like, huh, I got some work to do. And then the conversation's a little more smooth in that way. So how do you get people to get out? It sounds like you do a very good job of helping people get out of their own heads and just like do what is required from your professional experience to get the outcome that they're looking for. How do you go about that conversation?
Yeah, you and I do it actually very similarly.
Hell yeah. I knew I
Does
was doing
this?
something
Yeah,
right.
like I love conversations like
Bruno
because
just wanted to pat himself on the back.
well, I'm patting myself.
Yeah.
Let's all pat ourselves. It's always a nice. Everybody loves a good confirmation bias. It's the same thing. It's like complex systems theories, and going back to what I said at the beginning of we work with humans. Their head is the most complicated part in this entire game of the biomechanics. After you establish a baseline level of competency and knowledge, the optimization side is the easiest part. It's the communication, it's the buy-in, it's understanding where in this 3 steps, we have 10, but I kind of break them up into thirds. We'll just say 3 steps. Are they? And what needs to get done? How do I get them to fit those actions to check off those steps consistently happen? That is the challenging part. And it goes down to setting expectations, identifying actually what they want. Like, because pain is complex, and especially chronic pain, people think they need a complex solution. And that's what I've been seeing. Like, I've just been reflecting on why are people reaching out to me and working with me and not somebody down the street? Oh, there's multiple reasons. One of it is I look at things differently and I communicate things a little bit differently. So they think they need a hyper specific intervention. And sometimes it's like, no, we just need to do the basics. Whoever was treating you before either skip steps, or they didn't meet you where you were at. And that's a conversation I've been having earlier of I say like, hey, our first couple sessions, you're probably gonna be underwhelmed, and that's okay. Because we're gonna check off these basic things that weren't checked off either when you first got hurt, your past clinician, who the hell knows. But sometimes the most complicated solution is the basics. And when you look at, like, I love sports, Kobe Bryant, Michael Jordan, Tiger Woods, they do the basics better than everybody else for a longer period of time.
Yeah, I love your on the skipping steps because I don't know how many. So you get that in twofold, and it's usually in the super athletic population. It's like, well, they were back squatting all this weight, like they could probably go back to a super functional exercise, but like if they can't single leg squat, like maybe we had to take a couple steps back. I was with someone at work, and and I think that's why people go to you as well. It's like they've tried everything else, right? I've already gone to XYZ, nothing's getting better. What do I do? And like I had it's one of the teachers at work actually, and just looked at his hip range of motion. I was like, dude, you have like 0 internal rotation. Like, did anyone ever look at that? He's like, no. And I was like, all right, like I'm just gonna do a couple of exercises. He's like, oh, 7 out of 10 pain. Now I'm 0 out of 10 after doing a couple. Like right. Sometimes it looked like I'm like, this was not hard. Like this was a very simple thing that I gave. So I love the don't skip because like he was like, oh yeah, I was doing like some sled pushes where I was at last. I was doing this, I was doing that. I was like, just doesn't sound like you're actually ready for that stuff, even though you could bully through it. So I appreciate like don't skip the basics.
Oh. Yeah, it's super important. And it's like, I think that's where a lot of people get stuck is they're either doing the wrong simple things or they skip the simple things. Like those are like the 2 most common pitfalls I see in like the chronic pain area. They try like the cool mobility exercise they see on YouTube, but to even get into that position, they needed a prerequisite amount of motion that they don't have.
Yep.
And they're like, I just always have tight hips. I'm just going to live with it. It's like, all right, I'll see you when you get pissed off. I don't know.
Yeah, 100%. And there's something to be said also about like where, like what that person's intention is, right? So I have some people who come in, a lot of people do like the group fitness style classes, and they're like, oh, I can never barbell back squat without my back lighting up. I'm like, okay, do you care? So barbell back squat, they're like, no, it's just like in the prescription. Like, okay, cool. Like, do you want to be able to participate in that? Or like, are you okay with modifying? And they're like, I mean, if I want to squat and like get strong there, I'm like, cool. Like, there's a million other ways to squat. Like, are you cool with doing different versions that fit you instead of forcing you to fit that? Because we know right now it's X, Y, and Z reasons why it's probably not a smart choice for you. I'm always talking smarter, not harder. And some of them, to be fair, are like, no, I really want a barbell back squat and get my numbers up. I'm like, cool. I love that. That path just looks very different from, no, I just want to be able to like show up to class 5 days a week and I'm okay with modifying. Both are okay. But if you think A is B or B is A, you're going to set yourself up for disappointment.
Yeah. Setting up expectations, that's something that can always be refined. And I've kind of like did a hard reset with like all my patients, like even the ones I've been working with for a while and like they're almost getting ready to discharge. People that are like in the thick of it, people that are new patients. I kind of just like did a full out. I was like, all right, what are their actual end game goals? Do I know that? Do they know that? Let me just double check with everybody. And really hit hard on, once we get clear on their goal, the expectation of the work to get there and the possibility to get there. And it's done wonders for me of like being hyper specific of, you came to me saying you want your hip mobility to be better, but we can do that. Why do you actually want your hip mobility to get better? And it's like, oh yeah, because I want to be able to get up and down the stairs while I'm doing laundry and feel like a good wife. Or it might be, I have a race coming up, or it might be any insert meaningful reason here. They now understand that I really care about them. I know exactly what they want. Let's say their hip extension sucks and they want to be able to run. We get their hip extension to like 5. I want to get it to like 20, 30, but they also want to like layer in strength. All right, fine. Maybe you don't get to full hip extension, but enough where it'll improve over time as long as they're consistent. And we layer in the other things. So that's also another big thing of keeping people held back for too long. It was like the second issue on top of skipping steps.
It actually brings up a good point, because it sounds like what you guys do is very similar to me, where it's like you treat the entire person, like physically and mentally too, right? It's like you want to take everything into consideration. Sometimes I run into, it's like, hey, we set a plan in place, right? Let's say we crush the first part and it's like, hey, my back's feeling great. I'm like, okay, cool. Like now it's time to like hit the gym and like get into the fun stuff. Like that, getting out of pain gets us to the starting line. You know, most people treat it as the finish line. But then once we get to the starting line for their back problem, which they came in for, like, hey, by the way, like my shoulders acting weird. And I like, never mentioned it, but like, can you look at that too? Because they trust you and they want you to check that out too. But then the conversation turns into like, okay, sure, but where do your priorities fall? It's, do we want to continue ripping this back thing? Like, which one's more important? Do we switch gears, or do we like, and you know, same kind of deal. It's your health, your decision at the end of the day. I can give you my best clinical opinion, but at the end of the day, that's just, again, the expectation setting. Handle multiple complaints as they pop up along the route versus just getting hit with all of them at once.
Yeah. It's clarify, like getting clear on the objective and their priorities. Cause it's like, we as clinicians, we have objective findings that we care about. The person who is, like I said, the most important character, they have their own things. If those aren't aligned, there's going to be frustration. And I've learned that the hard way early on in my career.
Yeah.
And so I'll just tell them like, look, like, here's what I think. You're the one that I always say, like, it's your bet. Insert body part here. It's your knee, not mine. Tell me what you care about, because we can go one way that I think is progress. You might not have a different definition of progress. Let's lay that out right now. One, I think that's important. Two, I think it's like fundamental conversation for long-term success. And to the pain thing, that is like super important. If I say, here are 3 steps, we'll call it like pain, integration, performance, keep it simple. Once we get out of pain, you're going to feel really good and think we're done. But that just got you back to right before you got hurt. And you got hurt there. We need to go beyond that so we can fully put this to bed. And I think that's the hardest sell, especially for the trigger happy exercise enthusiasts, that once they feel good, they want to like hit the ground running again. It's like, all right, I'll probably see you in 3 to 6 months if you don't like be a grown up and do the hard work now.
Do you find yourself with all your running, just like, I don't know what injuries you've dealt with before or whatnot, but I'll be perfectly honest. Me personally, as soon as I feel good, my mindset goes right back to patient mindset. Like I have to really have to hone in, like, no, no, no. Just because I feel good doesn't mean I do the long run today. That I'm gonna put that off for a couple weeks. Like, because I had like some foot pain because I got pissed off, didn't have a good marathon, so that I just did some crazy training stuff as punishment to myself, which none of it sounds healthy. But like that's like part of it was like, oh, you know what? Screw it. I started feeling better. I'm just gonna send it again. And like do you find yourself ever in that with the racing, with the training that you do?
All the time. I am my worst patient.
Yeah.
Stu, guys, tomorrow.
I'm a human being.
Yeah.
I have a funny story about this. I have an older patient, and we've just been like hammering his hip mobility, and he's the most consistent. I absolutely love him. And he came in, I was checking his numbers, and I was like, hold on, you are like double my age, and your hip numbers are way better than mine. He goes, don't gas me up too much. I was like, no, I'm being dead serious right now. Really good job. And it's like always that if we as clinicians do everything we tell our patients to do, we have the athletic weapons. But it's the same thing of like when I get hurt, it's like, all right, full clinician mode. We're throwing everything but the kitchen sink, every little dirty trick possible. And once I feel good, it's like, all right, let's test this thing out.
Oh yeah.
Which I tell everybody was like, no, let's be patient.
Yep.
So yeah, I'm a human being, kind of back to complex systems. We have our own emotions, past experiences, psychology, environment that influences how progress and pain gets processed. And that has to be considered.
100%. One of our program director would always say the KISS principle is keep it simple, stupid, right? I think that is a very overlooked thing, in the sense of people want to like get back to doing their thing fast, which, makes sense. But also there's something to be said about not being pushed hard enough. So I see a lot of people who are in the flip, like those performance type people don't spend enough time doing the simple stuff. And it's like, it's kind of like damned if you do, damned if you don't, in a way where you can be in a place where simple stuff matters, but you don't do enough of it. That's a problem. Or you get to a high level and you're not doing you're not doing the basics, just like your Kobe Bryant analogy. There's a new level has a different devil, something like that. You know what I'm trying to say?
I like that. Yeah.
That is there's always going to be, like, even getting rid of pain, like there's always going to be a problem. People think, hey, I get rid of pain, like the world, like sunshines and rainbows forever. It's like, no. Once you get rid of pain, then it's like there's a new problem and a new problem and a new problem. And my responsibility is like, okay, like you're either like good to go solve that if you have all the equipment, you have the tools to all do that. But sometimes, like, that's why, implementation, not just information, like for us, it's like, hey, you can look up most of the stuff up on YouTube or whatever if you know what you're looking for. But it's, hey, I know your context. I know where you're starting. I know where you want to go. This is how we get there. That is the most important part about like being able to solve it with somebody. Like we can help them a lot faster get up through. It's literally like a Sherpa. Well, I always think of that analogy, helping people up the mountain.
100%. Like I was taught it. It's a Batman and Robin feel. Again, we spend a lot of time, effort, and all of us on this call are extremely passionate on honing our skills to serve people. And it's like, you get the title doctor, you get the success stories, It's very easy for your ego to inflate and think we're Batman. The reality is we're Robin. The patient is the Batman in the situation. Nobody cares about Robin. What is and it's the most and in my opinion, I think it's the most empowering thing, because when I get frustrated of like, why is this patient doing their home exercise? Why are they always trying to rush once they feel good? I was like, no, my job is just to serve and assist them. And sometimes it is, instead of handing Batman the boomerang, it's handing him the parachute. And that might be the best thing for him. And it might be a short little conversation, and that's okay. Yes, I know we all matter. We do care.
No, I know what you
care about us, but it's always putting in the priority. People go to a Dark Knight movie to watch Batman, not Robin, and that is okay.
100%. I mean, that's why I called my business NAV in the first place. I mean, NAV, like the NAV stands for something nerdy, but the navigation system is the same Batman and Robin thought process. Is, hey, you're driving the bus, but like if you make a turn, you make a detour, like you get off course, like I'm here to help correct you and get you there fast and safe. That's the whole goal. But dude, Abu, you are the man. I feel like we can just like keep rolling for hours, and I love that, but I want you to be able to enjoy your blizzard of a snow day. Do you have to go on to work today?
No, we just called a half day. I actually have to confirm whether or not we made the decision to fully close or not. What about you guys?
It is not looking pretty out here. Yeah, we're shut down for the day. Yeah, but
Yeah, I'm good enough. I only got 4 inches down in Maryland, so I'll be out. We clipped all the schools closed and all that, but we'll be fine.
Okay.
all right. Well, Abu, what we've been doing is asking all of our guests to give us your best. Go fix yourself and take us out. So let's hear it.
What is it?
Go fix yourself.
Okay. Go fix yourself.
Yeah, that's the energy we need.